My paramedics are around and my senior doctors and my clinical advisors are also there today. It's a happy day for us. Before we talk about this program, maybe I should say a few words about HMRI itself. Many of you know about HMRI. HMRI is Health Management Research Institute. It's a part of the Piramal Foundation, the corporate social responsibility of Piramal Enterprises. Our focus has been primarily health, and I'm happy to share with you that we're very proud to be associated with this program because this is the state and this is the city where we had developed many solutions that we've taken to the rest of the country. First, we leveraged technology, and already Milind and Jacob did talk about the accessibility problem. We believe equity is equal to availability, accessibility and affordability. These are the 3 A's of equity. And especially the poor people, the Dalits, the tribals, the slum dwellers, the minorities, and those who live in hills and faraway places, they have difficulty accessing services. So the key question is, how do we serve them? End of the day, health is one of the primary reasons why a lot of lower middle class people will slide back into poverty. Though there is a huge amount of economic development in this country in the last 2 decades, health is one of the reasons why one catastrophic illness can drive a family into poverty. So we started to focus on this one, and we believe in scalable solutions, and that's the reason why we keep talking in a humorous way with my colleagues. We say if you got a hammer, everything looks like a nail. We got technology, and we think technology can solve problems significantly. If IT and ICT, information and communication technologies, can solve problems for the world, and India could be a hub for delivering services for the multinationals all over the world, why can't technology serve its own people is a key question. That's where we started building solutions. And we built a health helpline starting with Andhra Pradesh, and today we are in about 7 states, the states of Chhattisgarh, Jharkhand, Karnataka, Maharashtra, Rajasthan, Orissa. So far, I'm happy to share with you, we were able to serve around 60 million people. 6 crore people called us so far on health-related matters. We also pioneered what we call colloquially Darwaza mein Dawkhana or Darwaza la Dawkhana or hospital at a doorstep, where we have taken vans all around which go to the villager and deliver a bunch of diagnostic services and screen people, identify people and refer them to appropriate hospitals. I'm happy to share with you more than 1 million pregnant women were provided antenatal checkups. More than 1 million plus people were identified for non-communicable diseases like hypertension and diabetes. And today, every year, we serve around 2 million plus, 20 million plus people all over the country. And while the numbers look very big, India is a huge country, size of a continent. Even a small state in India is larger than many countries in the world. So anything that we do has to be scalable, has to be replicable, has to be low cost, and has to be done very quickly. That's why we are very happy to partner with Medtronic, because they're the world leaders in medical technology, that we bring it to the ground. Where it comes to working with the philosophy and the values of Medtronic and us, there are similar kind of values. One of the key things that we believe is, once we identify a problem, you think big. You try to solve this problem at the national level and then start small. That's where today we are, and scale fast. Hopefully that's where we will go. That's our philosophy: think big, start small, scale fast. So in that, we believe that it is possible to provide a low-cost solution at the doorstep of the patient. The reason why doorstep becomes very, very important in a country like India is because the health-seeking behavior is extremely low. I'm told in the United States or other developed countries, typically a person visits a hospital or a doctor 5 times in a year. Now, nobody wants to go to hospitals. Like children don't want to go to schools. None of us want to go to hospitals. Who want to smell all that hospital kind of stuff? It's not a pleasant memory. But to be healthy, they say at least 5 times a person on an average has to go to a doctor. In India, it's about 1.2. So there's a gap of 4 visits. That means 4 billion visits is what we have to enable them. Now, India also is a huge country. In terms of accessing, people have to go to 30 kilometers, 40 kilometers to reach the nearest medical center. Sometimes the centers are not equipped or not staffed or understaffed. So therefore, we thought a smarter thing would be to go to the doorstep of the person. That's the reason why we say Darwaza mein Dawkhana or Darwaza mein Dawkhana. In Telugu, that's what we say that. So the idea is that we use this proof of concept that we're doing in Hyderabad in various low-income areas for about 70,000 population. We're trying to cover that in about a year's time. And once we learn our lessons and build the processes, appropriate technology and processes, the idea is to bring it to scale to the whole country. Wherever HMRI is working. Currently we're working in 7 states. Hopefully we should be going to many more states as we go further down. One of the key things like Milian talked about, which we undermine, is preventive care. As you know, there's preventive care, promotive care and curative care. But whenever we talk of health care, we have only medicalized the problem. Going to a hospital, going to a doctor after a problem has cropped up seems to be the attitude of a lot of people, which is very expensive. After the tympanium drum is damaged or something has happened, it costs a lakh of rupees or 50,000 rupees. Like they say in Hindi, na rahegi baas na bajegi bansuri. If you can prevent the problem before it becomes a big disease, I think a lot of money can be saved, a lot of suffering can be saved. Especially as HMRI, we are very, very concerned about children. And children, though, who have hearing problems can't be performing very well in school. And we know education is the way to get out of poverty. And we believe, therefore, ear health is as important as visual health for children especially. So what do? We do something called CIRC, screen, identify, refer and cure. So the idea is to create a seamless experience for the client to navigate the system. Oftentimes what happens is that part of the problem is solved, but the whole problem is not solved. So at HMRI we believe in giving comprehensive solutions. So when our paramedics go to the door, identify after screening, they refer to an appropriate surgeon or a hospital. In this case, we have partnered with the ENT hospital in Hyderabad, which is a premier institute, and some of the finest doctors are there available there. We refer them there. To make the life simple for the patient, we also have created a reception center where the patient is received and helped to navigate the healthcare system there, and finally the person goes back.